Hello, welcome to All Things Odd. I'm Dr. Natalie Phillips.
And I'm Whitney Hodges, the audiology resident.
Yeah, so it's just Whitney and I today, Dr. Galloway and Mary Kate, who's still here. This is like her last uh, week or so. They actually went into a surgery today to observe for a cochlear implant and also an osseous implant. So they took off after clinic and are headed that way. So Whitney and I are going to do the show today. Before we get to our show, I'm going to add our YouTube channel and have Whitney talk about it a little bit here.
All right, so here's our YouTube channel. It's a great way to view our content and share it, especially for people who maybe don't have Facebook. It's a great way to see past videos. We have it organized by playlists, so you can look if there's something that you are curious about. We've likely talked about it, so go ahead and go through there. We are doing our Better Speech and Hearing Month, so to last week's video if you missed that. We just talk a little bit about what that month is, why we're celebrating it, and what audiologists do. And we also have just lots of fun videos. So you guys should be sure to check it out and be sure to share a video if you think that maybe someone would find something interesting or you've heard a family member or friend complaining about it. It's a great way to give people some information and the videos are really fun to watch.
Yeah, awesome. Okay, so now as we remove that, like Whitney said, it is National Speech and Hearing Month still in the month of May. And we actually we were preparing for today and we have something funny that we want to share. So let me see if I can get that pulled up here. And so if you kind of follow us and saw in our story, we had shared a video and there was a question of, so Dr. Galloway, Whitney, and myself kind of came down our hall and, we were acting dizzy and everything. And there was the question and a poll put out there of, was one of us that took a fall, was it real or was it acting? And so we're going to play it in the raw footage and with the actual, because we sped it up and everything for our story. So if you missed the story, it's still there. It should be there for another maybe hour or so. Before it disappears. But I wanted to share this video and the actual footage to see what you guys think. Hold on, let me take this off and so that you guys can actually hear it because it is quite funny here and it goes along with what our topic is today. So I'm going to go ahead and play this video here and hopefully you guys can hear it. Oh my God. Okay, so that was the video. So if you showed up on time for the show today, and I see that we have a viewer here, then you actually got to see the raw footage. So basically, we were walking through. Okay, this is what we're gonna do. We're gonna come out of the room and bang into the wall and pretend like we're dizzy. And I have to say, I did slip and fall, but it was also so the whole thing was my major before audiology was drama. So I kind of played it off and said, okay, honestly, guys, was I actually acting or was this actually a fall? Well, everybody in the office knew it was a fall, but we put that out there. And so this does go along with the topic that we're going to talk about today. We thought it was kind of funny to show the raw footage. So if you're missing this, you're going to have to go back and watch it. But we are talking about fall risks and head injuries today for National Speech and Hearing Month. And so we thought that was kind of fun to show that raw footage of our story that we did all for social media. It's all for you guys. And so hopefully you guys enjoyed it. But okay, so the first fact that we want to talk about is that 25% of Americans over 65 years of age fall every year. And I'm not 65 years of age or older. but yes, so 25% of Americans over 65 years of age fall every year, which is kind of scary. I mean, even like today, I have some soreness, and it's just, you've got to be a lot more careful, right? And
Mhm.
over 800,000 patients a year are hospitalized because of a fall injury. And so while the risks of falls increase with age, I'm getting to know that they're really, falls are not really that normal. They're not a normal part of aging and are often preventable. So we wanted to kind of educate people a little bit more about dizziness, fall risks, things like that, that you could have. And so even though there's a lot of people out there falling, it's really not a normal part of aging. So don't think that it is. Just because you're getting old, you're going to fall more, but they're preventable. Like, that is really what we want people to know about.
Absolutely. According to the Centers for Disease Control, there are several risk factors that are attached to falls. So that could be lower body weakness. If you do have any dizziness or imbalance, certain medications can actually cause dizziness as well. Vitamin D deficiencies, poor vision, decreased sensation in feet, as well as hazards such as rugs and stairs. I know personally, with some individuals in my family, rugs had to be taken out just because they are an increased risk factor for falling. So,
Yeah, I think that those are some really good risk factors, especially like we said, that falls are preventable. And here are some of the things that we wanted to help prevent falls. So just kind of thinking ahead, right? So you want to try to check your home safety, remove trip hazards, like Whitney was saying. Look at the rugs and the stairs. You know, a lot of the times, homes that have stairs that don't have rugs on them, they're slippery. And if you either put lotion on your body or you're wearing socks in the winter, you can easily fall right down the stairs. The other thing about rugs too is rugs you can trip over, right? Like, I have a crazy dog at home, and he like runs around, and sometimes he can make our rug kind of buckle up a little bit and things. And so we do have some of those things that we have that are under our rug that helps make it stick to the ground. But even with those as well, so you want to try to remove these trip hazards around the home, maybe improve your lighting, maybe install handrails where you need them. Okay, here's one thing that I have to say. Like, I've learned to do this just in growing older as well. But slow down, like, slow down. And if anybody knows me, I literally rush around, right? I rush around, and I've learned to slow down when I'm coming down the stairs. I have fallen at home, coming down the stairs because I am trying to whip down those stairs. And so with all my stuff that I'm ready to go to work for, and I just slip and fall. So slow down. So literally, whenever I hit some stairs, I'm looking down, and I'm always looking at the next step. I'm going very slowly. Also in the morning, our silly dog lies on one step and takes up the whole entire step because the sun is coming right on that one particular step. So literally, I used to just kind of walk over him as I'm coming up or coming down. But now when I see him lying on that step, I'm like, dude, you got to go. I'm like, let's go,
get
and get
out
him
of
up
there.
and move it, because I'm not going to miss a step to try to get over him, because I don't want to fall down the stairs, right? So just kind of using common sense, but slowing down. Check your vision and your hearing annually. So again, that's a plug. You're checking your vision annually, and we also want you to come in and have your hearing checked, because if you're missing out on certain things and you're having to turn, and while you're walking or trying to, especially if you have a hearing loss and you're walking, let's say hiking next to somebody, right? Like, you literally might have to turn your head to watch them to get some of the visual cues. Well, then you're not watching where you're going, right? And so making sure that how your vision is and how your hearing is doing, that's also a good thing to help you prevent falls. Exercise and work on your balance. So this is now moving into, how do we improve your balance? Well, there are different exercises that you can do at home to improve your balance, your strength, and your flexibility as well. So there are apps. You can ask your doctor, you can talk to a physical therapist, whatever you can do. But those are some of those exercises that you can do to actually do the work to help you you gain better core stability. And then also the last thing is maybe consider, like, if you notice that you're kind of a little wobbly, or like when you get up too fast now, like you have to hold on. If you're a little concerned about your balance, then consider a fall risk assessment with a balance professional. So sometimes that could be like an ear, nose, and throat. It could be a physical therapist that will just kind of test you, put you maybe on a piece of foam, and you can kind of check on how, like, if you take away your proprioception and maybe your vision, are you able to still have that core stability? So they'll do this full assessment for you, where you can find out if you do have some balance issues that you should be concerned about. So then I kind of want to go into kind of just shifting a little bit into a concussion. And a lot of people, like, they don't know what a concussion is. Like, they think that a concussion is, oh, I don't play football, so I couldn't have, concussion, or I didn't have domestic violence or whatever, right? So I couldn't possibly have a concussion. Well, we actually work with a brain concussion and head injury specialist. In some of our previous shows, we actually had him on the show as well. We're going to work on trying to get him back in here. I presented with him as well on how an audiologist can work with concussion patients. But really, concussions, we're looking at patients that maybe have been injured from an auto accident, domestic violence, falls and other accidents, as well as sports and everyday head injuries. We even have people that come in that have concussions because I know this sounds silly, but maybe a visor from the car has hit them on the head, right? Like, you don't know exactly what it is. And according to the Centers for Disease Control, a concussion is really a traumatic brain injury that is caused by a bump or a blow or a jolt to the head, or a penetrating head injury that disrupts the normal function of the brain. So this injury typically leads to a series of changes in the brain. And we wanted to put that in as well today, because we've seen so many injuries and types of injuries here. And what I've noticed in seeing all these injuries, because we get to see these patients with this brain injury specialist, is that sometimes people don't know they have a concussion. Now, if you're in sports, there is a concussion protocol, right? So if you're hurt or injured, you have to go see an athletic trainer or whoever it is, and they have to do a concussion protocol in order for you to get back to playing that particular sport. But some of these symptoms can last for a while. So that's one of these things that we want to make sure that you understand, that maybe you were like hit on the head, or you fell, or you were getting something from under a desk and then you came up really strong and hit the back of your head. Watch for some symptoms that can be delayed or that can still not get better for a long period of time. Like, don't ignore anything, because anything could happen. And so that's what we wanted to educate you guys a little bit more about, what a concussion is. And don't forget to look for delayed types of symptoms as well.
Absolutely. Some common symptoms that people who have had a concussion include headaches, dizziness, issues with your balance, if you're having any difficulties thinking, focusing, confusion, changes in your sleeping habits, maybe change in your emotions, and things like increased headaches, slurred speech, just overall body muscle weakness and numbness. If you are having a seizure, obviously please seek medical attention. Loss of consciousness are definitely areas where you're going to want to seek that medical treatment straight away. Most of the time, individuals are going to feel better after a couple weeks following that concussion, but it does take a while for those symptoms and after effects to subside. So it can take longer than expected. Those that it may take longer to recover may have other risk factors as well, such as previous concussions, any neurological disorders, mental health disorders, any learning difficulties or stress. So there's definitely a lot of things that can kind of compound with those symptoms, which can affect how that concussion can affect you, if you're going to bounce back really quickly or if you're going to be having some of those longer lasting effects of it.
Yeah. And so the last thing we kind of wanted to talk about was what happens when a concussion or head injury patient comes to us, right? Like, how are audiologists part of the whole picture? And typically when we get a referral for somebody who has had a head injury, we start with a hearing test first, right? We start with the hearing test, see if anything is going on with just the hearing itself. And so we start with that. And then typically they have symptoms of dizziness or vertigo or imbalance or whatever it is. And so then we do our testing for that. We possibly do a video nystagmogram, which is looking at the inner ear to see if the inner ear is related to some of the symptoms. We also do a vestibular evoked myogenic potential test, which is a VEMP test. Sometimes we even, so also looking at a particular part of the inner ear. Sometimes we even do an ECOG or an electrocochleogram test because they might have, they have this feeling of pressure, right? Or fullness in the ears. And so the inner ear is in the mastoid bone, which is this hard piece, part of that skull and area over here. So if they had a head injury, it's very possible that it could have injured or something happened to the inner ear. So that's why we do some of those diagnostic tests. Now, in addition to that, if you know any head injury or concussion patients, you also know that some of the other things that they can complain about would be tinnitus, sound sensitivity. And so we can possibly do an evaluation and manage and treat the tinnitus and sound sensitivity. But then also we're noticing auditory processing disorders as well. So we're able here to do an auditory processing evaluation to help figure out, if they have symptoms from their concussion or their head injury that is not necessarily showing up in a regular audiogram or a hearing test, but it's the processing part of it. It's centrally located. Maybe there was damage where now they're not hearing as well in noise or with competing signals or sentences or whatever it is. And they're really struggling. And so with a brain concussion, head injury type of patient, we here at our office and at other audiology offices can be part of that journey and try to figure out, is it related to the ear and is it something that we can do to help? And so we wanted to start by educating you guys about falls, fall prevention, ways that you can take a look around your house and where you work to try to minimize and prevent falls, because again, it can be preventable. That's one of our major points today, is that falls are preventable. Slow down again. And then also don't forget that audiologists can have can be part of the journey and be part of the diagnosis journey and help you figure out if it's related to the ear and if there's anything that we can do about it. So I'm going to see if there's anything that Whitney wanted to add before we head out today.
I actually just got done doing one of these balance tests today, and you can just tell from patients. It's so nice whether we find out that your ear is involved or your ear is maybe not involved. That's still a piece of information that you can take back to your referring physician and hopefully get you some answers and give you some recommendations in order to help get you on your journey. So they're really interesting tests. It's always fun seeing patients be like, wow, this is really cool. So, but yes, definitely slow down, look at things around you, fall prevention. And if you're feeling dizzy, you should come see us.
Awesome. All right. So with that, I do believe we should be here next week as well. There's a lot of different traveling. So if we don't do a show, we'll let you know by social media, or we might have a drop and play one of our previous shows. But I do believe we will be here next week. So tune in next week. We have one more episode that is going to cover the National Speech and Hearing Month because it's the month of May. So we'll come up with another topic, and we will be here next week with a new show. We'll see you then.